Hi everyone, I'm Dr. Jaclyn. I'm a general dentist at Dental Design Singapore. And today we are going to talk about teeth whitening, but the difference between having it done professionally at a dental office versus having it done at a place like a beauty salon or even a hairdresser. The short answer is teeth whitening is a dental procedure, so it's ideal to have it done by a trained dental professional for best results and for safety. Just like I wouldn't be able to cut your hair properly, a hairdresser would not be able to safely and effectively whiten your teeth. Before we get into the differences, let's talk briefly about how teeth whitening actually works. So there are two types of whitening products available. One are stain removers, so things like whitening toothpaste, which have a high concentration of abrasives, so things that can lift surface stains off when you, for example, use a whitening toothpaste. This is useful for patients who develop a lot of staining on their teeth. Maybe they take a lot of tea or coffee or they smoke a lot of cigarettes. These are all just surface stains that can be removed with whitening toothpaste. So the difference between stain removal products and chemical whitening products is that stain removal products do not change the natural color of your teeth. They just remove any surface stains, which can make the natural tooth color look darker. Now, the second category of products which we are going to focus on today are the actual chemical whitening products. You can think of it in this way. When you go to a hair salon and you want to bleach your hair, they will apply a chemical bleach to your hair, which is usually in the form of a peroxide, and that chemical peroxide actually breaks down the dark colors. In the hair's case, it is melanin within the hair shaft, and that makes lighter or transparent pigments. So the hair goes from dark to light. And it's the same thing that happens within our teeth. So the whitening chemicals, they contain peroxides of varying concentrations, and these are absorbed within the tooth, and it breaks down the colored pigments inside the tooth from long complex molecules that are darker in color to simpler molecules that are lighter in color or transparent. So let's talk about the difference between having a teeth whitened professionally by a dentist and having teeth whitening done at a beauty salon or hairdresser. HSA has regulated that over-the-counter whitening products, so that means chemical whitening products that you can buy without a prescription, are allowed to contain only a maximum of 0.1% hydrogen peroxide. In contrast, if we talk about professional grade whitening products, so these are whitening gels that are used in the dental office or prescribed to you by your dentist, these can go up to 20 to even 35% hydrogen peroxide. So that's like a 300 times difference in the concentration of active whitening agent contained in the product. So for beauty salons, a lot of them, they may just buy over-the-counter products and use it on their clients, or they may be able to source prescription-grade products through the grey market. So grey market is things like Amazon, Shopee, where they are reselling professional-grade products, but because these are not licensed channels for sale by HSA, you don't really know what you're getting. So I always tell my patients, if you do go to one of these places and they claim they are using prescription grade products, number one, it's illegal. Number two, you will hope that at most nothing happens. That means your teeth don't lighten or change color at all, but that means they were probably quite safe. The worst case is if you are going to a place that uses or claims to use prescription grade products, the concentrations might be very high, and if you're not taking the appropriate precautions, you can sustain burns or injuries to the gums, the lips, the cheeks, or the tongue, because these structures are not supposed to come in contact with the whitening gel. So in a dental office, we would actually retract all these structures and protect the gums with a specific barrier material so that only the teeth are exposed to these very strong professional grade whitening agents. In summary, if you want to have a safe, efficient, and comfortable whitening process without wasting too much time or money, I would encourage you to see a dentist. Dentists are also trained to diagnose dental disease. For example, if you have gum problems or if you have tooth decay, these would usually be treated before we actually go on to whitening. Dentists are also trained to troubleshoot, and we can actually refine the whitening process to suit you. Because for a lot of patients, they may have tried prescription grade or even in-clinic whitening procedures, but they found it maybe too sensitive, but maybe different ways that will reduce the sensitivity and make the whole process a lot more bearable. I hope this was helpful, and we hope to see you again soon in the next video. Bye!